Good morning, everyone. I can see you all filtering in now. That is wonderful. Welcome to CERSH, the Centre for Excellence in Rural Sexual Health, Sexual Wellness Professional Development webinar series for July. Can you believe it? I wanted to start by acknowledging the traditional owners of the land on which we are on, acknowledging that it is also NAIDOC Week, paying my respects to elders past, present, and emerging, and also expressing my hope for reconciliation. Today, we are lucky to be joined by Budi, who's going to be talking to us about international students and sexual health. A very interesting topic, and I'm looking forward to listening to it. So thank you, Budi, for joining us today.
Good morning, everyone. I'm having a little bit of a problem with my connection at the moment. It always happens whenever there is time to actually do this kind of thing, isn't it? Okay, so I'm just going to monitor the chat. Someone will let me know if you can't hear me or if something is not working, please. That will be fantastic. Okay. Seems to be back on now. Okay, excellent. People can hear me. Great. So it must be my end. Thank you. Good morning, and thank you again for joining us. And sorry about this slight hiccup. It's always again, everything works well 5 minutes before we start, and then something is happening. So let me just great, excellent. Welcome to the webinar, and thank you for Melbourne Uni for inviting me to talk about this project on looking at international students and sexual health, and also the role of education providers in providing international students with sexual health information. My name is Budi. I work as a research officer at Monash University. And before I start, I also want to acknowledge the traditional custodians of the land where we are all calling from. I'm calling from the land of the Wurundjeri people of the Kulin Nation. I would like to pay my respect to the elders, past and present, as well as emerging leaders in the community. If you want to do your own acknowledgement to the country, you can do that in the chat room. Like I said earlier, everything works well until I was about to jump online. So please, please, please use the chat room to let me know whenever something is not working. Online technology, we are in it for 3 years, and sometimes the gremlins just out there trying to create havoc in whatever we're trying to do. So what we're going to talk about today is based on the research that we are currently conducting at Melbourne Sexual Health Centre, and to really look into the role of education providers, but also what opportunities available that we can actually provide international students with sexual health information. Before I do that, let's have a nice break. If you are familiar with menti.com, please go to menti.com and put in the code 4604847. What's the chance that that code is not working? Very likely. So there is a QR code there as well, just so people can actually do that.
The QR code is working, Budi, just FYI.
It's not working, or is it working?
It is working.
Yay. So it will take you to this question: what color do you associate sexual and reproductive health with? And they give you an options. It says voting hasn't opened yet. This is what I was afraid of. And of course, that's what will happen. Okay, give me a second. Let me do that. Hopefully it is working now. And yeah, it's working now. Okay, we're back. We're back, people. I got 17 people already doing that. We got red, green, pink. Facebook thing is closed. That's really strange.
I found I just had to refresh the page and then it worked.
God.
Just for anyone who said it was closed.
I'll put the link on the website or on the chat as well. So you might have to click refresh. Seems like it's working for some people. It's not working for everyone. We're getting there. We're getting there. Refresh work. Thanks, Suzanne. Thanks, Ed. So there's a lot of pink associated with sexual reproductive health. Red, purple, only one blue. Wonder why. And there's green as well. Fantastic. So I think pink is the winner for the color you associated sexual reproductive health with. Maybe one person who chose pink can unmute yourself, put it in the chat. And actually kind of say, why did you choose pink? Why is sexual reproductive health associated with pink? Maybe just put it in the chat. And Aggie says, red reminds me of Melbourne Sexual Health Center. Thanks, Aggie. It could be pink because I'm wearing a pink jumper today. So it could be that. Great. Now let's move on to using the same link. What is the cost of implant for people without Medicare? So if you don't know what implant is, that's the implant, the implants for mostly for female to slowly reduce the hormones. So let me just check that the Menti is working now. Hold on a second. I have to do this multiple times. Okay, if you click refresh, then the menti.com should be working. More than 300 for some people, 250 to 300, 200 to 250. It's only one person who believes there is 50 to 100, and one for 100 to 150, and one 150 to 200. Anyone actually know the actual cost of implant for people without Medicare? Maybe you would like to put it in the chat. Because I had a look this morning when I was preparing for this presentation, and it's roughly every single clinic that I look at has a different costing. And yeah, Tiffany says depends, Miranda, Cooper, IUD. So IUD is quite different to implant. Implant is the one that under the skin. There's the clinic costs as well. Yeah. So there's the cost is varies from anywhere 200 to over 300, depends on the clinic. So looking about international students who do not have Medicare or any health card, that's the cost that they have to, that's a cost for them, for female international students to put in an implant on. And Jenna says removal, so that's added another cost if students would like to remove the implant on. Not cheap compared to people who are on Medicare or who have access to the health card. Suzanne says private script is 170.30. Yeah, private script, you still need to pay for someone to put it under your skin. So that's another cost. You got private script and you got something else. Excellent, thank you. All right, let me just make sure that you can access the next question. The next question is, what is the waiting period for international students to access pregnancy-related medical issues under their OHSC? Brain trust. 3 months, 12 months, depends on the cover, depends on the OHSC provider. A lot of people say depends on the cover and depends on the provider. Some of you believe that it's 12 months. So this is access termination of pregnancy. Forgot to change the question. Oh, Belle, thank you so much. So implants for free at Young People's Health Service in Melbourne. Excellent. We need to know that because a lot of international students are looking for where they can get this. Susan says both medical surgical termination of pregnancy. So then this is where the complexity lies, because when I had a look at different OHSC providers, they don't actually specify which termination of pregnancy that falls under the cost, that the one that they're going to reimburse. This is another thing when we talk about international students and health inequity. So different providers have different level of insurance cover. Some insurance cover with some providers, there is no waiting period. Some have 12 months waiting period. I had a look at Medibank Private this morning, and they only offered the non-waiting period to select university and education institutions. There is no uniformity, there is everything is different. And you think about international students who most of them, including me, when I was an international student, we had no idea what's happening, and we basically just pay what university is telling us to pay, with all the different level of cover and the different waiting period. It's making it confusing for a lot of us. So if you are working at university or any other tertiary education provider, have a look at your OHSC providers, have a look at their policy, and I think it's worth asking them the question. So why is it that students have to wait for 12 months in some cover, and for other students, they can actually get it immediately? So it's worth to do a little bit of that advocacy. Excellent, thank you so much. And I am so glad that we have overcame our little bit of tech issue. I'm touching my desk at the moment, hoping that it won't happen again. So international students and sexual reproductive health. International students, as a lot of you know, is the 4th largest export in Australia. That's attracting more than 500,000 students just in 2022. And it brings about more than 25 billion to the Australian economy. So when we think about the economic impact of international students, not only they are paying full fee, full tuition fee, they are also paying rent, groceries, entertainment, and a lot more. So it's actually a big business. The international students in Australia, in the ideal world, is covered under the ESOS legislation. And the ESOS legislation provides a national standards for tertiary education institution to actually look after the well-being of their students. It falls under Standard 6, and Standard 6 actually it requires tertiary education or any education providers to make sure that they have enough resources and they have provide services to maintain students' overall health and well-being. And we often think international students as a separate group in our society, but it's actually an integral part of the Australian fabric. I was an international student myself, and I definitely played an integral role or an important role in the community. So we cannot see international students as being a separate group to non-international students. For some of us who are attending this webinar, we know that to date, there is no universal strategy for sexual and reproductive health in relation to international students. So quite a few of the initiatives are run by each education institution. So Monash Uni has our sexual health program. University of Wollongong have the sexual health kit. It either run by each state and territory, such as the New South Wales Health Hub, or it runs by an individual organization. So Sexual Health Victoria has a module called Dating in Australia. As we all know, a lot of these initiatives rely heavily on government funding, and that government funding is very far in between. So the funding is not always available for institutions and community health organizations to actually create program that is sustainable and long-lasting. So this is what the International Student Health Hub looks like. It's from New South Wales Health. And because I'm from Monash Uni, so I have to put it in there, our sexual health program from Monash University. And I see from the list of participants, some of you were very much involved in the development of this program. So now we're going to do another brainstorm idea. What factors that can prevent international students from accessing sexual and reproductive health information and services? We got language barrier, visa conditions, knowledge of services, knowledge gap, stigma, lack of awareness, confidentiality as an issue. David says language barrier. Money, someone type in money, I can see it flashing. Okay, fear, money, knowledge of the health system, cultural taboos, stigma and cost, culture and shame, don't know where they are. Financial, so a lot of cost, stigma, not aware of the health system, don't know where to access them, language barrier, insurance as well, level of cover, different level cover of insurance, as we discovered when we did the opening round. A lot of shame associated with stigma and shame of visiting a clinic or asking questions about sexual reproductive health. Health system literacy, another priority, thank you. Low levels of health literacy, and I think that's about it. So a lot of what you were saying before was actually what a lot of studies have found when it comes to international students and sexual reproductive health. So there is a systemic issue, limited services, limited resources, as well as the OHSC limitation to access sexual reproductive health. We got socio-cultural barriers coming from sex-negative society, stigma, and also religious and cultural influence on sex and sexuality, and costs associated with seeking treatment. And personal barriers, what someone was saying before that I actually quite like. Some people just don't see it as being relevant to them. Then you got the cultural and religious influence, where sex only happens within heterosexual marriage, English language proficiency, and also the unfamiliarity with the Australian healthcare system. So a lot of what you brainstormed, a lot of what you shared in the earlier slide has been found to be some of the factors that are actually contributing to international students not accessing sexual reproductive health information and services. And that intersections put that students in the middle. And if we think about international student who's new to the country, who's not familiar with the system, then you can see why a lot of students actually they fall under the radar, or they're not actually they're not accessing sexual reproductive health that can result in unplanned pregnancy, the increased rate of STIs, and amongst gay, bisexual, and men who have sex with men, an increased rate in HIV notification compared to non-international students. Now, the reason why we conducted this study, because there's quite a few papers out there that look into barriers for international students, that interviewed international students, get their opinions, and also ask them about what can be done. There's actually not many studies that look into how education providers, staff working at university, TAFE, English language schools, and private colleges viewed sexual and reproductive health. When I did the lit review, I couldn't find any, either in Australia or worldwide. There were some about sexual assaults and prevention of sexual violence. There are quite a few about sexuality education in secondary schools, but when it comes to university, it's very lack. I'm very sure someone will correct me and say there is a paper about staff perspectives at university or tertiary education providers on sexual reproductive health. I simply couldn't find it, and I tried to search why. So there is a knowledge gap in there. It's mostly unknown whether staff see themselves as playing a role in providing international students with sexual reproductive health information. So part of this study is to really look into that opportunity. Does tertiary education provider, do they actually see themselves as having a role, given that the students are over 18 for the bulk of them? And if they are seeing themselves as having a role, what kind of initiatives that they can implement to provide students with SRH information? We wanted to hear the perspectives from the staff, but we also want to compare and contrast it with international students' opinions. So what we're trying to do, we're trying to hear from both sides of the fences and see if we can come up with a solution that will address some of the barriers that students experience to access sexual reproductive health. The next slide this slide in particular is very much a little bit dry. It's going to do about the methods. So we did in-depth qualitative interview with staff members, and we did focus group with international students. Still planning one more focus group. Still haven't made up my mind on that yet, but it will have to take place in the next few weeks. The research methodology that we implement is decolonizing research methodology. So it's really focused on conversation and sharing knowledge. So it breaks down this misperception about researchers have to be constantly neutral and objective. We know that we bring our own presumptions, our own knowledge into the conversation. So decolonizing research methodology actually allows for that conversation to take place. All the interviews conducted online because we are still not able to do one-on-one interviews in person following the pandemic. So I interviewed 15 staff members one-on-one, and we also from university, TAFE, ELICOS providers, English language school, and to date we did 2 focus groups with 9 international students. The researchers in this room know that all the interviews, focus groups transcribe verbatim, and also the use of reflexive thematic analysis to really look deep into the transcript, compare, contrast the transcript with my own presumption, my own lived experience, and to really dig deep into the experiences of staff and international students. So this kind of thematic analysis is very useful for me, at least, to really challenge what I know and to come up with something new and something that I never have thought before. And it's a lot. There's a lot in the interviews. I'm not going to lie to you. A lot of people say a lot of different things. A lot of people also say similar things. There's quite a few themes that emerge, quite a few things that we have to decide not to include in the report, because when it comes to sexual reproductive health, it's a broad topic. Where do we begin? And one of the interviewee actually said to me, where do you want me to start? Where do we start when we talk about sexual reproductive health? It's a huge topic. So narrow it down to three main aspects. The first one is the role of education providers. The second one is the barriers that education providers are facing to provide sexual reproductive health, information and education to international students. And lastly, it's about opportunities and future directions. That's where I really want to focus on. So this research is not just about identifying problems, it's also about exploring possible opportunities. In the next few minutes, I'm just going to show you some of the interview excerpts from what staff and students shared with us when it comes to the role of education providers. So I think majority of the staff and students clearly say that tertiary education provider, university, TAFE, English language course, colleges, they do have a role to play when it comes to providing students with sexual health information. And I like this particular quote from a TAFE instructor. It's about health. It's about overall health in general. So they're going to be happier people. They're going to contribute to society a lot better. We want to make sure that they are looked after. A few staff members also say that providing SRH information and education can actually positively contribute to study outcome. And I also like this quote, when I think, we have a duty to care for the students, provide them with education, but also responsible for their health and well-being. So unless they live a healthy life in body and mind, looking after their health and well-being, they're not going to achieve well academically. So if we want them to succeed at university, we have to look after all of them, and that referring to the body and the mind. One staff member actually able to link education providers' role with the ESOS legislation. And talking to the research team at Monash, we thought that not many education providers are actually aware that maintaining students' health and well-being, including sexual reproductive health, is about the role of their institution to provide them with information. Again, a lot of students also say that education providers have a role because that's where they learn about the world. And I do like this quote from someone who's in their late teens, who's also a state TAFE student. The internet is the worst place that you can ask questions because it will take you to porn websites. That's definitely not healthy. Education organizations such as universities, schools, the responsibility to teach younger generation what the actual correct way of having intimacy and having a sexual relationship with someone looks like and what it is supposed to be. Instead of someone having to end up like 10 kinds of STDs and transmitting it to hundreds of thousands of people, that's the worst case scenario. So according to these young people, we don't want to actually be part of the problem, for us to actually, schools and universities to actually play an active role to inform and educate young people when it comes to SRH. And someone was saying before in the earlier when we did the brainstorm, yes, some students don't think that this is relevant to them, but we cannot use that as an excuse to not providing SRH education to international students, because international students are not a homogeneous group. There's a lot of us that actually play with our peers when we are in Australia. There's a lot of exploration, sexual exploration taking place. So we just, like these students said, we just want to make sure that we cover all the bases. Even for students who at the moment may not think that it's relevant to them, they might find it relevant to them later on. So it's about making sure that access to information is available regardless of whichever journey or personal circumstances that they are currently at. Now that we identify that education providers do have a role when it comes to providing international students with sexual health information, they also share with us some of the barriers that they are facing to do that. And one thing that jumped up that I never have thought before is about their own personal discomfort and lack of knowledge to talk about the topic. And I like to use this quote because it does indicate that lack of knowledge. Even though this person may have, this participant may have knowledge, may have been living in Australia for a long time, there's still that gap because not all of us are aware about SRH. Us in this room, in this webinar, we may be more aware about it because there's our professions. When we talk about the general staff at university, TAFE, and English language schools, this is probably the topic that they never have to consider before. Staff are also human beings. And staff are also influenced by the social taboo that's out there when it comes to sexual and reproductive health. It's come from this one participant. There is a taboo. There's a taboo to talk about sex. And that can result in staff feeling that, am I the person to talk about this? Do I have to talk about students about SRH every week? And that kind of taboo have an influence on making staff feel uncomfortable to approach the topic. Stigma is not just about international students accessing information. Stigma is also for staff to actually access information and knowledge. And I like this quote because it says, the standard strategy is just to give them a link and have students do it for themselves. But because the stigma is there, so some students may not able or may not want to read it. It's not easy to talk about it. It's not easy to educate students about it. So it's the stigma of not being able to normalize sexual reproductive health as the main obstacle. And this is coming from a university health staff. And I like this quote because it does indicate that intersection between providing sexual reproductive health information with the staff's own gender. The staff is a cis woman who's working at a TAFE and felt uncomfortable to talk about sexual reproductive health to male students. Is it appropriate for me to do that? Do they want to hear it from me? And this particular quote actually have concern about students lodging a complaint if staff members do raise an issue about sexual reproductive health. And also staff's own cultural background has an influence on their ability or their comfortability to talk about sexual reproductive health. And this particular staff is from China and thinking about, well, if I didn't talk about it in my country, then what will be the best approach to provide sexual reproductive health information to the students that doesn't make it uncomfortable for both the students and I? So again, one thing that I didn't think about before, because I kept thinking about sexual reproductive health and education providers from a systemic level, but I forgot that staff are also influenced by their own cultural upbringing, the social stigma and taboo around talking about sex in public, as well as their own lack of knowledge that can create a barrier. The second one is about limited funding and resources, and there is a huge inequity when it comes to resources. As this participant said, ELICOS, TAFE, a lot of ELICOS and TAFE don't have access to health clinics, or they don't have clinics that are on site. So that creates an inequity when it comes to resources and access to health. Lack of funding as well. Again, as we discovered earlier in this webinar, government funding when it comes to sexual reproductive health is very far in between. So that can actually have an impact on the ability for education providers to establish programs and to sustain programs that talk about sexual reproductive health. And what happened here is, and I like to use this quote because it does link sexual health with other health condition. So sexual reproductive health should be seen as an overall part of our well-being, instead of being compartmentalized as something that is separate. And for institutions that has an on-site clinic, I interviewed one person and they said that, yes, we do have a clinic on site, but they are busy. We are busy. It's over capacity. So limited resources, even for institutions that have access to clinic. Staff are feeling overworked, and there's a lot of competing priorities, as we know. Now, using your brain, I'm just using you here to really dig deeper. What are the barriers that we haven't talked about that may prevent education providers from providing SRH information to international students? So lack of knowledge, yeah. So that was something that we found. Not my job, yeah, the role, confusion about the role, whose role is it? Worried about being accused being inappropriate, that's definitely came up in the previous interview transcript. Lack of confidence. Privacy concerns, yeah, that could be it as well. That didn't come up in the interview, but it's good that you actually mention it. There's a concern about privacy. Time, limited resources. Thank you. Assuming someone else is addressing it. So confusion about the role, whose role is it to actually provide this information? Lack of organizational support, fear of offending cultural norms. Thank you. Don't see students often. That actually, I didn't put it in here because I have to really think about what to present to you. That actually came up in one interview where the majority of students are online. So they don't see students often, and they kind of ask me the question, so what can I do? So that's definitely on topic. We got relationships between educators and students. Yeah, not all students have good relationship with either their educator or their institution. Assume students already know, a lot of assumptions. Thank you. Disclosure training support. I'm not quite sure what that meant, so maybe we can put it in the chat what that meant. and fear of disclosure. Yeah, absolutely. And personal religious views also don't agree. Absolutely. And misconception that students aren't interested in receiving the information. I just want to sit on that for a bit, because when we speak to the students, they did say that their institution should provide them with the information. So I'm just wondering whether we put our own boundary, because we are making that presumptions, instead of actually talking to the students and ask them what might work for you. So that's a very interesting reflection. Thank you. Catherine says, support for teachers to know how to respond to disclosure, what steps to take. Thank you. So that's about disclosure training support. Thank you, Catherine. So we identified the role. So education providers definitely have a role. Staff thinks that, student thinks that. There are some barriers for staff and for institutions to deliver sexual reproductive health. But using the colonizing research methodology, we just don't want to focus on the barrier. We also want to focus on the opportunities and future directions. Unsurprisingly, both staff and students said funding. Government needs to give us funding. The funding needs to be ongoing and sustainable. And I like this quote from a university staff, looking for some funding from the government to promote international students' well-being, because international students contribute a huge part to the government income as well. And from a student who really think critically about this issue and really think about the role of state and federal government, at the end of the day, students don't have Medicare, so they need to be supported in accessing health services, because students don't have the same access to health in comparison to people on Medicare and non-international students. I put this quote because the students think it's very unethical for the government to not provide funding and to let students and institutions to find their own way of providing sexual reproductive health. So there is a question about health equity and access to health. The other opportunity after funding is about having a centralized and comprehensive knowledge hub for international students, a one-stop shop, as this participant said. At the moment, there's no comprehensive information out there. So how can students access information without having to navigate multiple resources? And also have information written by experts and maybe also written by students. And also like this, because this resource is not going to benefit the student, but the resource is also going to benefit staff members who are constantly working with international students. Social media is something that a lot of staff thinks is going to benefit. We know students are on the phone. I'm on the phone all the time. So we know that students are on the phone all the time. So having a message on social media just to raise awareness, that would be fantastic. And I also like this one because this is coming from a TAFE staff member with limited resources. So something that can be easily shared. I just have a look at the time. I'm always over time, sorry. Students also say there's a perspective in there. So there is a way for, there's a role for a comprehensive centralized website. And making sure that the information is available through student portal. Synthesizing information was mentioned by a student. So there's a lot of information out there, but how can you synthesize it? How can you make sure that it is relevant? And how can you bring it all together? The students don't get confused with a lot of the information that's available out there. and also by another students. Because of this conflicting information, the students can not only get confused, but they may not be, it may actually turn them off. So again, ways to provide correct information. And also making sure that it is relatable. So not just translating resources, but actually work with community members to make sure that the information provided is relevant to them. The New South Wales Health International Students Hub, I showed them to a few of the participants, and they said, yes, we should have something like this in Victoria with adjustment, with improvement. So one of the improvement is making sure that it is more holistic. So sexual health doesn't sit separate, but it's actually part of the overall health and well-being, according to this one participant. And when we're talking about students, and we brainstorm a few ideas, and one of the ideas is having a chat function, so students can actually ask questions live and having a response in real time. So that's something, an improvement that could be made if we are to replicate the International Students Health Hub. I'm going to be very, very quick because we have quite a lot to cover. Hang on. Oh, I got the chat room. Okay. So again, International Students SRH, as part of the overall health and well-being, that was shared by both staff and students. Another opportunity is for an outreach with existing service provider. And for this one particular staff who's addressing Melbourne Sexual Health Center, to get someone there to the English language school and just talk about sexual reproductive health, and that could be useful because there's a lot of confusion about access to health. Who is a GP? What is a GP? What's the cost? So having an outreach team that actually visit the site can be beneficial, and this can be done in both metropolitan and regional area. Peer education, peer-to-peer interactions mentioned by both staff and students. I like this one because as students or even as people in general, if we have problems, very, very rarely that we ask our parents, especially when it comes to sexual reproductive health. So having a peer that can actually we can talk to, have an understanding about the context is something that can benefit international students. Once students reflect on HIV prevention strategy and think that there is a benefit of having a targeted outreach for gay, bisexual, and men who have sex with men, but then also realize that just because it's targeted doesn't mean that the information should only go to this particular cohort. Everyone can benefit from having access to information when it comes to HIV prevention strategy. And the training for staff as well. As we discovered earlier, staff members do bring their own personal, cultural, religious values, lack of knowledge. So having a training for staff members can actually, it can be used to challenge their own stigma and to think about and provide them with information about services and all the available the common sexual reproductive health that international students are facing in Australia. And a few staff members actually reflect on an ecosystem. Do we have an ecosystem specific to international students when it comes to sexual reproductive health? The top quote talks about where do students go if it is something that is not clinical? You know, the particular university has a pregnancy workshop for students, so students are aware about what's going on, but that's not universal. So it does ask that question. A lot of the information that we give to students, if you have concerns, go to your GP. But as one participant said, GP are busy and they may not be able to see students right there and then. Nurses are busy as well. So what's the ecosystem? What can we create to make sure that we provide opportunities to students and making sure that they have options to access information. I'm not going to do that Mantheos Melbourne brainstorm because I'm running out of time, but this is the kind of thing that I thought that might be able to capture it in a diagram or in an image. How all of this ecosystem might work to support international students provide with their sexual reproductive health. So starting with a knowledge hub, so the website and social media, the use of peer education, the use of an outreach program, health professionals as well, so especially for diagnosis and treatment, and staff, training staff, so they are aware about the services that's available. They know what to say to the students. So when all of these are working together, that's what in my head create an ecosystem. So students have options. They are not just about, it's not all about go see your GP when they don't even know what a GP is, but they can access information. They know there are peers that they can talk to. They also know there's going to be an outreach team that's going to visit the site, and they can actually ask questions during one of those visits. So in the last 1 minute that I have, we're just going to talk about, SRH, as we all know, because we are here. It's an integral part of international students and health and well-being during their study and stay in Australia. So yes, education providers do have a role, and now we actually have staff working at tertiary education to actually say to us, yes, we do have a role. We just don't know how to do it. We don't always know what's the best way to do it. So the opportunities that are listed here, including peer education, outreach, having a knowledge hub, and also providing staff with the training, are some of the ways in which we can empower tertiary education providers to do something about sexual reproductive health when it comes to international students. And of course, it must be supported by systemic change. So government play an important role to provide ongoing sustainable funding to make sure that institutions are able to run initiatives, but also most importantly, work with overseas student health cover providers to remove the waiting period for sexual reproductive health. And I'll put it in there, collaboration is key. And when I went through the different policy of overseas student health cover, when it comes to male reproductive health, there is no gap, no waiting period. When I started looking at gynecology, pregnancy, assisted fertility, there's a waiting period. So again, health inequity exists. So we need to work with OHSC to make sure that we remove that barrier. And on that note, I think I'm on time. So thank you for listening to this finding. And apologies for quite a few of those technological glitch. And I think this is time for Ash to open the floor to question.
Thanks so much, Budi. That was great. I think David's put in the chat, needs a longer session. Yes, there was so much information there. Could definitely talk to you about it for a lot longer. But I think that you gave a great overview of the research that you're doing. So thank you so much. Are there any questions? Please feel free to put them in the Q&A function or just in the chat. And yes, and Budi has some time to answer some of our questions. Just on that, as you were saying, Budi, just at the end there, going back to that question of the waiting period, what was the kind of average waiting period for termination services that you found in your research?
So 12 months is the average one.
12 months.
That's for the basic cover, OHSC cover. But again, this is where the inequity kick in, because if you're willing to pay more, then there is no waiting period. And one thing that I was actually quite surprised, especially with Medibank Private, they only offer that to select institutions. That's really not fair, isn't it?
Yeah.
Yeah.
David's just written in here, anything that you wanted to add about students living with HIV or accessing HIV-specific services?
Thanks, David. That didn't actually come up in the interviews, but having worked in the HIV sector, people living with HIV or people diagnosed with HIV, they can access medication for free. So regardless of their medical, not for free, but they can access it regardless of their medical status. David knows this better than I do because my brain is a bit all over the place this morning. But in saying that, that information not necessarily known to international students. So if they diagnosed with HIV during their study here, they may not know that they can access medication. So they might have to resort to importation, but also the stigma associated with it. They might actually not access anything because they don't want their family to know. So there's a whole heaps of study there about HIV international students and access to services and treatment.
A question has come up in the chat that if you had to choose one area to be the first priority for SRH for international students, what would you choose? I'm smiling because that sounds like a tricky question.
Look, I will say my supervisor who's here today like to say to me, think about the immediate strategy. So a replication of the New South Wales International Student Health Hub with Victorian lens, with improvement, because there are some issues with that website. It's probably something that we can immediately implement because we can all work together to produce this website. A lot of the other strategies may take time, may take funding, but website is something that's we can do that in the next 6 months, I believe.
Yeah, great. From Jacinta, you mentioned culture earlier. Are there resources for providing culturally safe sexual health education, considering that many students may not have had this education in the past? So what resources can you recommend to us?
Are there resources culturally safe sexual health education include? I know Ali is here. So the Center of Ethnicity and Health might have some resources. I think I'm just trying to think back to the interviews, Jacinta, and I think some students actually said, look, it's not about the information itself because the information are not there. The cultural barriers will be, are the students willing to access it? That's another lens that I didn't put in this presentation. If they are not willing to access it, then we have to ask the questions why. Yes, and I think that's New South Wales Mahas has a great resources, yeah. But I think that's where we have that slight disjunction or slight barriers there, because a lot of organizations do produce resources, but if they don't actually work with international students on how to distribute it, what's the content look like, that is just going to sit there in the online space gathering dust. Gathering virtual dust, not real dust. Felicity says, yeah, like Jessie, yeah, there you go. Thank you. Thanks, Felicity. But I know quite a few people in this webinar, so I'm feeling a bit under pressure at the moment.
No, you've done an excellent job. We're out of time. Thank you so much again. This recording will be on our website and YouTube page in the coming weeks. So please feel free to share it with people you know who might benefit from Budi's presentation. I know I certainly did. So thanks again for joining us, Budi, and thank you everyone as well for attending. Have a nice day.
Thank you. Bye.